My dear students, I would be asking you to focus your attention towards the topics today because these are some of the topics which have been asked just recently. So I would be taking up these esophageal lesions and I would need your undivided attention. The first of the topics I would be taking up is siderophenic dysphagia. Now, once I give a term like this, you people tend to get confused. So now the other alternative name for the same would be Plasmuller-Vincent syndrome. So most of you must be acquainted with this disease. But the thing is that you have to remember the alternative names. I intentionally used the name siderophenic dysphagia initially because most of you don't understand that synonyms are asked. So 3 names for the same disease: Plasmuller-Vincent syndrome, Patterson-Kelly-Brown syndrome, or siderophenic dysphagia. All the 3 convey the same meaning. Now, as far as this question is concerned, I have been seeing that it has been asked in the form of a typically classic case scenario: a young female with spoon-shaped nails with iron deficiency anemia and dysphagia. Absolutely right, because it is common in young females, especially women, and it is characterized by the presence of anemia, iron deficiency anemia, and then there is this typical spoon-shaped nail koilonychia as well as dysphagia. Now, what is important about Plasmuller-Vincent syndrome is that we have got the presence of webs in the post-cricoid area, the post-cricoid webs, which cause the dysphagia. And this basically happens to be a pre-malignant condition because Plasmuller-Vincent syndrome can predispose these females, especially the females, to post-cricoid cancer as well. So what is important about Plasmuller-Vincent syndrome or Patterson-Kelly syndrome is the presence of iron deficiency anemia, spoon-shaped nails, dysphagia, and atrophic glossites, and maybe post-cricoid cancers. So effective screening for post-cricoid cancers is important. Now, sometimes we get confused with another option given as Shaskis Rings. And you have to remember that Shaskis Rings are an anatomical thing. And basically, what are they? These are basically submucosal circular rings present at the site of distal esophagus, especially corresponding to the site of scamocolumnar junction. Now you know those scamocolumnar junctions are important in case of especially cervical cancer, and here as well in case of esophagus we have got a prominent scamocolumnar junction, and the scamocolumnar junction is characterized by the presence of these rings called as Shaskis Rings, which can cause luminal stenosis. So they can be a source of dysphagia because pathologically these rings are caused by the fibrous tissue, deposition of fibrous tissue at these sites of luminal stenosis. And you have to remember that they are incidentally picked up by barium swallow, and the common treatment modality is dilatation. A single dilatation can just effectively remove the rings. So that is, by the way, about the Shaskis Rings. Now, we have got this important clinical condition, what we call as the Mallory-Weiss syndrome. Now, what is Mallory-Weiss syndrome? You have to remember that especially young males, especially those who are alcoholics, and especially those who just go on a drinking spree, and they sometimes vomit forcefully. And this forceful vomiting is against an open glottis. Very, very important. Against an open glottis. And what it does, it produces a tear. a submucosal or a mucosal tear, mostly just near the cardia of the stomach. So, a submucosal tear or a mucosal tear as a result of forceful vomiting with an open glottis, especially in alcoholics, causes the Mallory-Weiss syndrome. Now, what is important about Mallory-Weiss syndrome is that this tear is usually superficial, but it can just go deeper and cause perforation. Now, what is important is that it is predisposed by forceful vomiting, and in case there is more forceful vomiting, that can predispose to a full perforation. So Mallory-Weiss syndrome is this much. Now, what is important is another thing which we usually confuse, and that is the Borehouse syndrome. Now, what is Borehouse syndrome? It is same. You can have a male, especially an alcoholic, and who has this forceful vomiting, and this forceful vomiting is against a closed glottis. It is not against open glottis. It is usually against a closed glottis, and that causes through and through full perforation. And here the patient can present with chest pain. The patient can present with substernal pain, or patient can present with epigastric pain depending upon the length of the tear. And this is an emergency, and patients here forcefully vomit, as I have mentioned, against a closed glottis. And you have to remember that characteristically this question is asked, what is Mackler's triad? And Mackler's triad, M-A-C-K-L-E-R-S, triad is basically the combination of chest pain, usually the chest pain, along with vomiting and along with emphysema, because it can produce emphysema. Now, chest radiograph would in later stages detect hydropneumothorax, and you have to remember that this Borehouse rupture is advanced. It is more serious than Mallory-Weiss tear, because Mallory-Weiss tear is usually a mucosal or a submucosal lesion, and this Borehouse rupture is a transmural lesion. It just goes through all the layers. So I hope this class of mine, in which I have just made an introduction about Patterson-Cayley syndrome, or the Shaskis Rings, or the Mallory-Weiss tear, or the Borehouse syndrome, would just be very helpful for you as far as your preparation for surgery in your NEET exams is concerned. Thanks a lot.